Hello, I'm Steve Triffletti, and today we're here with Plymouth Profiles, which is an opportunity to profile people from the greater Plymouth area. This is a special presentation. Many of you may know that several years ago I was involved in a car accident. I was rear-ended, I went to the hospital, and after I was treated and before I was released, I was told that I was fine from the car accident, but that I had a brain aneurysm, and that I needed to see a neurosurgeon. I did, and I had surgery about a month later. It was successful. I'm a survivor. And since that time, I've been involved with the Brain Aneurysm Foundation, which is an international organization located near Plymouth in Hanover. And I found that prior to my surgery and after, that the Brain Aneurysm Foundation was very supportive to me and to other people in my family. And so today I'm delighted to have with me a representative from the Brain Aneurysm Foundation, a good friend and colleague. She is with us today and is Taylor Buckley. Taylor, welcome.
Thank you, Steve.
So Taylor, how long have you been with the Brain Aneurysm Foundation?
I've been there 2.5 years.
And tell us a little bit, first of all, where's it located?
We're right in Hanover, Mass, near the bowling alley, if you know where that is. But we do have national, international reach, as you mentioned, but we're all headquartered right here in Hanover.
And what is your position at the Brain Aneurysm Foundation?
I'm the director of events.
Great. And we've gotten to know each other because we have an annual event, and I'm going to mention it right now. It is the Brain Aneurysm Awareness After Hours. It's our 6th annual. We do it in September, which is
Awareness Month.
Brain Aneurysm Awareness Month, that's right. And it's going to be this year on Thursday, September 5th, Tavern on the Wharf from 5 to 7. So as the director of events, why do you do events?
Well, your event is the perfect example of the awareness component. That is a critical piece of our mission so that everybody can learn about the signs and symptoms of brain aneurysms as well as any risk factors that they may have. So every person that learns about our mission through an event like yours is possibly another life saved from a brain aneurysm rupture.
So let's talk about that, about creating an awareness. How many people have a brain aneurysm?
1 in 50 in the U.S.
And of those people, what's the rate of survival?
It's about 50% survival rate.
Okay. And so in some cases, what would be the most common symptom of a brain aneurysm?
The worst headache of your life is the most common symptom. That's how many survivors describe it, and that's definitely the most clear symptom that we know of.
And when people are treated, who normally treats them?
A neurosurgeon would be able to treat you.
And locally, where is that available?
Our founder actually is located in Boston, Dr. Ogilvy at Boston Beth Israel Medical. But there are other facilities that can treat you as well, but that is a fun fact about the BAF, Dr. Ogilvy.
He was actually my surgeon, and actually his, I think, nurse practitioner, Dee Buckley,
Yes.
was also attending to me. So I was fortunate because they caught it before I popped.
Yes.
But we have had people at one of my events in years past. We had Thomas Timlin, who was the director of Department of Transportation.
That's right.
Here in Massachusetts. He did pop.
Yes.
And yet he survived.
He did, and he actually had a second that was treated later because of the advancements in research. They were able to go back and fix the second one as well.
Yeah. So he's one of the success stories. So the events, and we certainly do this to raise awareness. Why is it important to raise awareness?
Well, like we discussed, people need to learn the signs and symptoms to be aware of. They also need to learn that there can be a family connection, similar to our honorees for your event this year. We also, have awareness so that people can spread the word in their own community, take that back to somebody else. and learn about our other efforts around advocacy for federal funding, for more research, and other ways that they can help share this message with others.
So focusing on the awareness, you mentioned this year's honorees at our event.
Yes.
We have honorees every year, and it's the Walker family. And the matriarch of the Walker family did have a brain aneurysm. Tell us how the awareness has helped that family.
So after her rupture, her family members were able to get scanned, thankfully, and the daughter actually learned that she also has an aneurysm, which is being carefully watched and treated, but that unfortunate situation has led to other family members being aware of their own aneurysm and being able to go through the proper treatments of that.
And each year we do honor a family or a person. Last year, Sergeant Santos, who worked at the Plymouth House of Correction, was our honoree. Unfortunately, he didn't survive, but his family was there, and they were honored. And previous to that, we had the Hackett family and their son Johnny, who at age 3 suffered aneurysm. So all ages, all
That's
types
right.
of families. In my own family, to raise awareness, not only were my children and my brother and his children tested, but we went beyond the family of origin to the extended family. And I have a cousin in Texas, and she was diagnosed with 2 aneurysms, and she was treated, and one of them is being monitored. The other, she had treatment for it, and now she no longer has that. So certainly raising the awareness can help save lives.
Absolutely. I think you've done that more than you know, probably through your event.
And tell us, how many people does the Brain Aneurysm Foundation serve? Do you have any idea?
So we have national reach, even global, through our website visitors and webinars. We have events all over the country. We have support groups that we send materials to and work with on a regular basis. And then, of course, the research that we fund is also all over the country. So I think the effects
So do the events that you serve, do they raise money?
We do, yes. So.
And give us an idea of the type of events. I mean, ours is an after hours, so it's
It
a
is.
typical, I guess I would say, like a Chamber of Commerce business after hours. People come, there's no pressure to do anything other than to sit around and enjoy food and maybe a drink and some music.
Some music, and you have your silent auctions and your raffles. So we do raise money through most of our events. A lot of them are more of like a run, walk, or 5K. We do have similar things to yours, little brewery events or comedy show, smaller scale things like that that are just as impactful in getting the word out.
Yes, it's true. I mean, ours does raise money, and we feel we've done very well over the years, but really the focus has always been to raise awareness. And I think also to be supportive to survivors or to
Absolutely.
families of people who were affected, maybe didn't survive, but to show that there's support in the community.
Absolutely. Yeah, there's an
not only
incredible.
from survivors, and I know I and my family, my friends, my colleagues, are very grateful for the support that we did receive from certainly my doctor, from Dee Dee, but also from the Brain Aneurysm Foundation. So in addition to raising awareness, you mentioned advocacy.
Yes.
Tell us a little bit about the advocacy.
So we work year-round on advocacy efforts. We have an annual day at the Capitol to lobby for more research. So brain aneurysm research is underfunded. There's $2.08 spent for every person afflicted, which is extremely low compared to similar diseases. So we are big supporters of Ellie's Law, and that asks for additional funding through the NIH. So we're always looking for new avenues through advocacy to further the research in this space.
And that's certainly something we've done. I know we've locally in Massachusetts, we've spoken to our legislative delegation. There was a time we met with the governor. in the past. So certainly creating the awareness, seeking the support. People don't
Absolutely.
always realize that you can treat. It doesn't have to be a death sentence. In my own case, the doctor was fortunate, a fairly new procedure where he was able to take a titanium stent. I think he probably came through my femoral artery, went up to my left vertebral artery, and the stent remodeled the aneurysm and eventually
Wow.
caused it to go away. So I was very fortunate
That is.
and am happy to be able to not only support the foundation with our annual event, but to be available to speak to people both at public settings, but also privately.
Absolutely.
So with respect to the advocacy, you have an annual event in March in
in
Washington,
Yep,
D.C.
it is typically in March.
And what happens?
We have people from all over the country come. They can sign up to be an advocate and visit with their representatives, their senators. We work with different organizations to arrange meetings, and we have survivors and caregivers, people of all backgrounds that are passionate about getting more research funding, and they meet with those individuals or their staff and share the importance of passing a bill like Ellie's Law.
And if people are watching this and want to contact the foundation, how would they do that?
We have a website, bafound.org, and all the information you could need is on there, including contact, including how to become an advocate, as well as other ways to be involved.
And what's the phone number?
781-826-5556.
Thank you. And so Taylor, in addition to the awareness and the advocacy, you mentioned research. I know
Yes.
a few years ago when Johnny Hackett was being honored, the money was being earmarked for a research chair. What's a research chair?
So we have many events or families or individuals like yourself who can earmark fundraising or a gift specifically for research. So in that circumstance, it was named for Johnny Hackett, so it can be named for a survivor, for a loved one lost, or in the name of an event, community. But it designates the funding for further research in the space. So we're giving out an additional 15 research grants this September, $640,000. So that brings our cumulative total to over $5.5 million.
That's a lot of money.
It is a lot of money.
And does it make a difference?
It does. We're seeing tremendous advancements in the research space. There are really exciting things coming up about easier ways to diagnose aneurysms. There's interesting stuff going on about blood biomarkers. So all kinds of innovative things that will really make a difference for how people are diagnosed, how they're treated. And you brought up earlier that a lot of them are preventable, and most are, but they have to be caught, like yours was, in such a lucky circumstance. But we want there to be more that are found earlier, like yours was, and not just by a fluke situation.
The biomarker and the blood just seems like such a great opportunity, because when you think back to Johnny Hackett when he was 3, you know, if he had the worst headache in his life, could he really communicate that?
Exactly.
Whereas when you have somebody so young, if you could able to catch it through other types of routine testing, that would certainly make a big difference.
Absolutely.
And you must have all kinds of examples of people. I know in my own case, I didn't really have the worst headache in my life. I had discomfort in the back of my head, but I just kind of put it off and said, oh, well, I think I was probably working out at the gym and I don't know what I'm doing. I don't do it right. And I probably just strained myself using some machine doing strength training. But it probably was a sign that I was having something going on.
Right, but so many people do the same thing. I mean, I think we're all kind of brought up a little bit to do that, you know, push through, or, you know, it's probably nothing. You have other stuff to take care of, so don't add it to the list, that kind of thing. But it's really important to be your own advocate for your health if you notice something like that. And when you know the signs and symptoms of a brain aneurysm, not to live in fear, but just another thing to be aware of. It's something that is very real that could happen.
That's another type of advocacy. I know when I was diagnosed and before my treatment, they prescribed Brilinta, and it was very expensive. And I have very good coverage with Blue Cross, and they said, "Oh, we're not going to cover it."
Wow.
And I said, "Why not?" And they said, "Oh, well, we only cover it for transplants." I said, "I'm having brain surgery. I think you need to cover it."
Yeah.
And I was able to appeal and do that. But I mean, as an organization, you're able to advocate and support people if they call up and they've got a concern or a problem to someone who can talk to them about it?
Yeah, definitely. We hear from, like you said, so many different stories of people all over the country, and we definitely can offer, other suggestions or avenues to try, but there are a lot of local support groups, usually through a hospital or VNA, that kind of thing. So those are resources that we have as well.
Another curveball that my family was thrown was when my children and my brother's children were being tested, everybody was fine except for one. My niece, who's an ER nurse of all things, was being denied coverage for the test.
Wow.
And she contacted me, and I did contact her insurer, and it provided my medical records.
Right.
And it was through that that we're able to successfully arrange for her to be covered. So in a lot of cases, we need to advocate not only legislation, but just advocate on a personal level to help
Absolutely.
people navigate the challenges of our health care when they want to
Exactly.
deny coverage for medication, deny coverage for a test,
It's true.
and yet it's reasonable and necessary. So going back to the foundation, so you have events. Are these events at certain times of the year in September, or is it throughout the year?
We do have them throughout the year. The majority are in September because that's our awareness month. So people like to rally around that time of the year, as you do with your after hours. So it makes it exciting but busy. But we do see other things in the spring and encourage anyone to get together to share awareness at any time during the year.
And tell us a little bit about some of the other people at the foundation. Now, your executive director, Christine Buckley. Tell us about Christine.
Christine is the first ever executive director and the only executive director of the Brain Aneurysm Foundation, which feels especially exciting this year as we're celebrating 30 years. So she came on as the first employee and has seen us through this far, through many accomplishments that we're celebrating this year after 30 years, including giving out the most ever research grant awards. She started that whole initiative. So that's Christine, our executive director. And then we have Lynn Nuttall does our marketing and communications work. And we just launched a new website that we feel will offer up all of our information in a much more easier, user-friendly manner for everybody. So I encourage everyone to check it out, bafound.org. And we have Grace Hilton, who actually lives in New York City. So she does our social media and digital content. And Susie Frost works closely with me on the events. And Martha DiLorenzo is in our office. She's just master of all things. And we also brought on Maureen, who's helping with our database operations, just to further enhance all the work that we're doing behind the scenes, keep everything running smoothly.
And you provide speakers. If some group wanted someone to come and speak, you could do that?
We do, yep. We can offer up suggestions and work with whoever needs a speaker to try to find the best fit.
I know that I have spoken before Rotary, Lions, and Kiwanis clubs, and in
Yes.
fact, one time on behalf of the foundation went out to California to speak to a Rotary club that was donating a research chair.
Very cool.
And so the foundation, though, really facilitates those speaking opportunities when they're needed.
Definitely.
And so, again, to be able to contact the foundation and have that available, because again, that gets out the awareness, gets out the story. Also, I understand working with the medical community. What kind of work has been done with primary care physicians?
So we are part of Pri-Med, which exactly what you just said educates primary care physicians, over 7,500 of them every year. And that's really critical that they incorporate brain aneurysms into their daily triage of patients as a possibility, just as we talked about that for patient themselves to advocate for any symptoms that they're having. The primary care physicians should have that on their radar as well. And they often don't and are dismissive of things, as you mentioned. And of no fault of their own, they have many things going on, but this really works. Our partnership with them really works to educate them on having those resources to make a proper diagnosis or refer out if they have to.
And in addition to the primary care physicians, is there any efforts with emergency room doctors? I would assume that maybe sometimes people present themselves at an emergency room.
Sure. I don't know of any specifically. I think maybe that's wrapped into that a little bit, but that's certainly an area to expand upon.
Now, Taylor, I ask all my guests, when you're not doing your work at the Brain Aneurysm Foundation, what do you like to do in your spare time?
Well, I have 3 children under the age of 3.
Wow.
So that takes up most of my time. But this summer we're really enjoying the beach and just being outside with them, going on a lot of walks. And
I had 3 under 3 when my twins were born and my son was 2. But what about you? Do you have twins?
we don't. We have 3, he's like 3 in a couple months. He turned 3 in March. An 18-month-old and a 5-month-old.
Wow, good for you.
It's a little busy.
Well, one of the nice things is they can do a lot of things together as they get older because
Yes.
they're so close in age.
We're looking forward to that. It's a little crazy right now.
Yeah, good. And do you live locally to Hanover?
I live in Whitman, not far
Good.
from Hanover.
Good. And so again, if people have joined us before we wrap up, what is the contact information?
So please visit bafound.org, bafound.org, for all the information you could need. All of the staff is on there. You can email us. Phone number is on there, 781-826-5556. And
I know that Christine Buckley has done this before with me, so thank you, Taylor Buckley, for doing this.
You're welcome.
Also, Christine does radio as well, and
Yes.
she and I are scheduled, I believe, to be at WATD just before the event,
Yes.
first week of September.
That will be great.
And she will join me as she has in the past. And you've attended our event. So again, our event is Thursday, September 5th, 5 to 7, Tavern on the Wharf, which is in Town Wharf in Plymouth. You can get tickets by going to the BA Found website.
Yep.
If you don't get tickets ahead, you can pay at the door.
Mm-hmm.
It's a $20 donation. It's a nonprofit, tax deductible. And there'll also be an opportunity for door prize as well as a silent auction. So
Yes.
you've been to the event before. Tell me, how would you describe it? What did you think about it?
I think it's a very welcoming, positive atmosphere, a lot of fun people just stopping by after work or just come have some food and drink, like you said, bid on some raffle items, auction items. But everyone's very positive, happy to support the cause and learn about the cause so that they can educate someone else. And I think a lot of people are surprised if they hear your story for the first time. So it's really nice that you continue to offer this in the community.
And it's true, you don't always know who you're going to touch, and yet I've certainly heard over the years that people who weren't aware became aware because of that. And there's also been survivors that have attended
Yes.
the event.
Yes, I think that's a really important aspect too. We touched on it earlier. At the run walks we see that, but something like this, kind of just a little more casual. You don't have to sign up ahead of time really, just show up and have that sense of community around you is really nice.
And we've tried to honor those that didn't survive or those that survived but maybe didn't get the same result as other survivors. But then it's also an opportunity to celebrate those that have survived, I know for many of us, and there are usually at least a half a dozen or more survivors there. I often have them help pick out the raffle tickets for the winners of the raffle, but it's celebratory because we feel fortunate. I mean, I was told that after the surgery, be prepared for being depressed or being sad or whatever. I was joyful. I was just so like, oh my gosh, I survived this and I'm okay.
Absolutely.
So
right. Everyone's journey is very different afterwards, but it is so nice to have that network of people who have experienced the same thing.
And so the message really is there is life after brain aneurysm diagnosis
Absolutely.
or brain aneurysm surgery.
Yes.
And it's really an opportunity. This event we have coming up, it's certainly our opportunity to give back to people and also not only to raise the awareness in a preventative way so that maybe people will catch the symptoms before the pop occurs.
Exactly.
And then beyond that, to raise money for the research, for the advocacy, so that going forward, maybe our children and our grandchildren will benefit from what those of us as survivors have undergone in terms of the brain aneurysm. So,
Absolutely.
Taylor, thank you so much for being with us.
You're welcome. Thank you for having me.
We appreciate all that you do, all that the Brain Aneurysm Foundation does.
Yes.
And again, you and I will be together on September 5th.
We will.
From 5 to 7 at Tavern on the Wharf.
Yes, we will. Looking forward to it.
Thank you, and thank you for your support.
Thank you, Steve.
This completes this edition of Plymouth Profiles. Please join us for future presentations, and certainly you can contact me by email, fst@plymouthlaw.com, and the phone number is 508-746-1464. If you know someone who's been touched by brain aneurysm, please contact us. I'm Steve Triffletti. Good day.